everyone. Bonjour à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. My name is Kendra Titley and I will be your moderator. Je m'appelle Kendra Titley et je serai l'animatrice de ce point de presse. Please note that Mayor Watson and City Manager Steve Kanellakis will be unavailable to join today's media availability. Veuillez noter que le maire Watson et le directeur municipal Steve Kanellakis ne seront pas disponibles pour le point de presse d'aujourd'hui. I will now invite each agency to ask their question. You may ask one question with a follow-up. Par ordre alphabétique, j'invite maintenant chaque organisme à poser une question et une question de suivi. We'll now start with, nous allons commencer par Dan Tykema, CPC Ottawa.
Hey folks, I just had a quick question for Mr. Willis on the trees and the CIP there. There's been a lot of community concern around these trees, and Mr. Willis had mentioned some of the kind of ongoing efforts to work on them, as well as the CIP just independently. I was wondering if you could kind of run me through that again, just to make sure I understand what conversation has been happening around that, and if it's enough to make sure that these trees are protected.
Thanks for your question. First of all, the community improvement plan area does not include any of the lands along the Hunt Club corridor, so that the areas where the trees are on are not subject to the program. And that's why we asked the issues be dealt with separately. We got direction from council back in the winter to start negotiations with the airport on a potential land swap with them. So we're in negotiations with the airport. I'm not going to discuss negotiations at length, but the discussions are ongoing. And that's why staff feel that in order to keep a kind of a good faith negotiations going, that's why we ask that the issues be kept separate.
All right, that's helpful. You in the meeting, there was a lot of discussion about the airport and what the airport can do to kind of improve its own situation, or what the federal government can do. I know this was touched on and is touched on in the report, but just at a high level, can you run me through the CIP and how you see council's decision today helping the airport going forward?
So certainly, you'll appreciate that the airport has about 100 hectares of land that they've had ever since they've been an airport authority that they have not yet leased out. So this is land that's been sitting underused for many years. The airport does struggle to attract tenants to that space because it's not available for sale. The land is owned by Transport Canada. The airport cannot sell it. It's under agreement with Transport Canada. So, but if an airport can get tenants on that space in aviation-related businesses and industries, it provides more services at the airport. It diversifies the Ottawa economy. It gives them a revenue stream that then they, as a nonprofit organization, can apply to other airport activities and services, such as the pursuit of new routes and destinations. So what the community improvement plan does is it allows a break on the taxation when a property is improved. It's only a portion of the taxes. And that money then gives a much more competitive position for the airport to market the lands.
Thanks so much.
Thank you, Dan. We'll now go to Andrea Bennett at City News Ottawa. Andrea, are you on the line? Okay, we'll go to Ted Raymond at CTV Ottawa.
Hi there, can you hear me okay?
Yes.
Okay, perfect. My question is for the Medical Officer of Health. I'm just curious about, I'm going to start about the COVID-19 wave that we're seeing right now. We're seeing healthcare staffing shortages across the board, ER closures in the Valley, that sort of thing. With this latest wave, I'm wondering if you can comment on what kind of risk Ottawa's healthcare system is in, and is a return to mask mandates on the radar locally?
Yeah, no, thanks for the question. So you're right. I mean, we are in a resurgence. We are seeing increasing COVID detected in the city's wastewater. We are seeing an increase in the proportion of tests coming back positive for COVID. And over the last couple of weeks, we're seeing an increase in the number of individuals requiring hospitalization. So clearly we're in a resurgence based on province-wide genomic screening. It's a newer variant than what we've dealt with in previous waves. It's the BA.5 variant of Omicron. As of the end of June, the provincial science agency was projecting that it was accounting for more than half of all COVID cases, and the proportion rising. The thing to know about BA.5, it is quite contagious, and individuals who even may have been infected in the previous Omicron waves in January or April, because this variant is sufficiently different and has some ability to escape immunity, those individuals are susceptible to reinfection. The most important thing that people could be doing right now are as follows. If you haven't gotten your booster, so third dose booster for everyone over 12, and a fourth or higher dose booster for those 60 and over or with significant underlying conditions, this is the time to get those. We have ways to improve, frankly. Amongst those 12 plus, there's about a third of the population who don't have their third booster. For those who are 60 and over, who are at the highest risk of severe outcomes, only about half have their fourth booster. So it strongly encourages those individuals, if they're not up to date, to make an appointment at one of our clinics or with a pharmacy, or if their family doctor provides the vaccine, get that. With respect to masking, certainly, when the province stopped the requirement under regulation for masking in indoor public spaces, here at Ottawa Public Health, we continued to strongly recommend masking. Just walking around the city and in stores, certainly the proportion of people wearing their masks has been decreasing. So the fact that we're into a resurgence, we would again be strongly recommending this is the time to be putting the masks back on when you're in an indoor public space, or even if you're outdoors and you cannot maintain distancing. Again, if you're having symptoms, you have to think it may be COVID, and you should be staying home and not going to get-togethers and the like. Now, with all that said, we've had a tough 2.5 years, and summer and being outdoors is a less risky proposition for transmission than at an indoor event. So it's really important still, despite the resurgence, that we socialize, but what our recommendation would be is to do it in a safer manner, and to do it outdoors, maintain distancing, and have your immunizations up to date. And of course, those individuals that are at higher risk of severe outcomes need to take additional precautions. Not in a position to comment on the situation involving the healthcare system. That's better asked of the leadership and spokespeople from, for example, the hospitals. What we have seen, though, in the past is that as the wastewater increases, staff who lived in the community are at risk of exposure and at risk of becoming ill. So important for healthcare workers to make sure that they are up to date with their immunizations and to be taking the precautions that we're recommending for everyone to avoid getting infected in the community.
Okay, thank you very much for that. Now, again, my second question is also for you, Dr. Malachny. It's just changing topics to the overdose situation that city partners have warned about recently. From a healthcare perspective, from a public health perspective, what immediate steps do you think need to be taken at your level to sort of minimize the impact of this toxic drug supply? How can the city, how can OPH work to better prepare itself for the next bad batch?
Well, I think we need to respond to this current situation. I mean, as was reported yesterday, police and paramedic emergency responders, responded to over 20 overdose situations, and unfortunately, 5 of those involve fatalities. So that's tragic. I mean, those are members of families and then friends, and we've lost those people. And the challenge is people do not know what's in the drugs that they're purchasing and using. So at this point, one of our key roles is to raise awareness, with the public, with people who use substances, both directly through various channels, but also through our partnerships with organizations who interact with people who use substances, to make them aware that the risks are even higher right now. A key principle is don't use alone, because if you happen to overdose and you don't know what you're taking, then there's no one there to help you. So a buddy system is very important. If people aren't comfortable having someone with them, then make people aware. Say if you're in a rooming house or that kind of situation, leave the door open, make someone aware, and be part of your safety plan. There are also a national phone line that you can call up a support worker to support you if you happen to have an overdose experience. So there are options to reduce the potential risk. There are also supervised consumption sites where people can go and be supervised and be responded to if they overdose. The other thing people can be aware of is, what does an overdose look like, to recognize it as quickly as possible, and then should have Narcan available with them to administer that immediately and call 911 for help. So those are some of the immediate things that people need to do right now with the risk that we have in our city. The other thing I would point out is that it doesn't take very much fentanyl or carfentanil or any of these highly potent opioids to be in a substance. And it may not even be an opioid. Someone may be purchasing on the street another type of substance to use at a party or what have you. And very, very small trace amounts of these substances can lead to an overdose situation. So everyone needs to be aware. Certainly, we are working with our partners here in the city, and we're going to need the support of provincial and federal governments to continue to take a comprehensive approach to address the underlying drivers of the opioid crisis that we've been observing. And we will continue to work with our partners. We have a key role in terms of sharing information, of working on destigmatization, and contributing with the partnership in terms of making progress to the comprehensive approach that's required.
Thank you very much.
Thank you. We'll now go back to Andrea Bennett at City News, Ottawa. Andrea, are you on the line? Okay, please feel free to reach out to medias@ottawa.ca and we can answer your questions. We'll now go to Taylor Blewett at the Ottawa Citizen.
Hi, my question I think would be for Mr. Willis. Can you describe what, if anything, the city is going to do to try to ensure that the financial benefit the airport and its future tenants would realize because of the city investment in the CIP program, how that's going to translate into commensurate positive outcomes for city taxpayers, like really making sure that does happen?
Thanks, Taylor. Well, first of all, to be eligible for the program, again, this is very different from our other community improvement plans in that we're dealing with the Ottawa Airport, which is a nonprofit organization who is responsible for leasing the land. So if a new tenant comes in and leases their land, that's new taxes to the city, much of which will come to the city, some of which will go back to the tenant as part of the rebate program for the construction of the new facilities in the community improvement plan. And then the airport authority, which is a public body, will get increased lease payments, which will assist them in their operations. So there's increased municipal taxes and the airport gets increased revenues for its operations. So two separate public entities are benefiting from the development of this. So again, we're foregoing a portion of the city taxes to try to incentivize something to happen. It's part of what we think needs to be part of a broader strategy to help the airport expand and diversify their operations. But there is clear public benefit if the airport has more resources available to enhance its services to the traveling public, attract new routes, et cetera.
And follow up on a different topic, the $60 million that's being added to the Stage 2 utility and contingency budgets. Will this transfer of funds impact any other city projects? And if so, can you outline what those impacts are expected to be?
Thanks for the question, Taylor. I can take that one. No, this isn't impacting any other projects at the city. We're not redirecting any funds. We had a financial funding strategy attached to the report. We're going to be leveraging some of our rate reserves to be able to do the Cleary water main, and then we'll be leveraging transit tax and development charges debt to pay for the rest. So it's not taking away from anything else that we're doing.
Thank you.
Thank you very much. Nous allons maintenant à Frédéric Papin à Radio-Canada.
Frédéric Papin, Radio-Canada. Hello, question from Ms. Amilcar on the LRT Commission of Inquiry, which should wrap up tomorrow with its last witnesses. For OC Transpo, have you been watching the hearings yourself? What do you expect over the next few weeks? Are you preparing changes? Are you keeping an eye on things? Because the LRT is working pretty well currently. So what do you think happens next? Answer. Thank you very much for the question. I think it's a bit too premature to make any decisions. We'll continue to serve users. We have a plan. Our plan's always been very, very clear. We'll look at the recommendations from the public inquiry, but for the time being, we'll wait for the final results of that hearing process. Thank you very much. No further questions.
Merci. Thank you very much.
For them anymore because I don't really have a lot of time to do them, or